Hello, dear friends. My name is Sofia Dorinskaya. I am a doctor and the head of the Center for Medical Information. Today, I want to invite you to train as a Vitagnost. I want to tell you a story. A client came to us and told us that he had had an autoimmune kidney disease for a long time. He also has psoriasis. I.e., now the situation has gotten to the point where doctors are saying that he needs a kidney transplant. We started working with him, i.e., well, that's about it. Well, kind of. It's a situation where there's nowhere to go. Kidney transplant, autoimmune kidney disease. And how will a transplant help if there is one? If the immune system is already, so to speak, going crazy, then where's the guarantee that the new kidneys will take? And so on and so on. Well, it's just a vicious circle. No one knows what to do with it. And then he comes to us for a test, and that's when we start looking into it. And I'll tell you, from the very first time, from the first set of questions, set meaning, well, a package? Yes. From the first package of our questions, the situation. It unfolded right in plain sight. What did we find out? It turned out that this person has been taking the medication Ramipril for 9 years, which was prescribed to him. Naturally, he has kidney disease, which causes high blood pressure. He was prescribed this medication, and he has been taking Ramipril for 9 years. And he takes it in such a way that, first of all, he himself forgot about it. Subtitle editor. Well, he takes it, as if it's nothing, like it's no big deal anymore. And secondly, the doctors. Semkin, who see him face to face. For 9 years they also already. It seems like Ramipril is all he's ever known, as if he was born with it and nothing else exists. And the medication Ramipril has a side effect. It causes acute renal failure, as well as anaphylactic reactions. Do you see what I mean? So, do you understand what the difference is between a Vitagnost and medicine? We have a different perspective on a person. We look at a person from a different point of view. If you look at all the perspectives that exist about a person, right now, it doesn't matter if it's medicine or some other kind of help. They somehow look at a person as a set of byproducts. Here lies the liver, here are the eyes, here are the arms and legs, and somehow the head is separate, in a completely different box, and the intestines aren't connected to the liver or the pancreas at all. These are all completely different things. The psyche is just a byproduct, off in a closed room. But we only have one person, you see. And that's how you and doctors look at a person the same way. Doctors do too. So she sees this kidney, and then she sees the blood pressure, and then she sees something else. And that's how she sees it all. But she just can't see it as a whole. Vitagnost has a completely different view of a person. We stand from a different position, and since we have a different point of view, we ask different questions. We simply ask different questions. And that's why they've been dealing with him for 9 years. The situation is only getting worse. When we pointed out this medication, Ramipril, to him and it was discontinued, you wouldn't believe it. He sent us his test results within a week, and they were completely different. His kidney issue started improving and began to resolve. Can you imagine? He sent us his next test results. So, what do you have to say to me? The point of view that a person is just a bunch of byproducts in a bag, not connected to each other in any way, doesn't work. But the Vitagnostics point of view works. The Vitagnostics point of view, when we look at a person from a different perspective, it works. So, if you want to help a person, that's not medicine. Well, because medicine, as I just told you, Ramipril and all that stuff, you see? No. Vitagnostics is not medicine. but no one is forbidden from helping their fellow human. No one is forbidden. No one is forbidden to say, open and read this same RLS. What does it say there? So, of course, we want to see people who want to help others. We will be very happy to have doctors, because right now doctors are in a difficult situation, especially in Russia. But I know that people have been coming into this profession for many, many years, studying to help others. And of course, it captivates you and shapes your life.